graduated in 2016, was a healthcare management major as part of the NHS. And upon graduating, I worked at Mount Sinai Hospital for a little less than 2 years, and then transitioned to another company called CareCentrix, which I'll get more into, and shortly followed by a role at Horizon Blue Cross Blue Shield, which is a health insurance plan. So my goal today and kind of my goal going forward is to always kind of give back. To me, Georgetown was a special place. It will always be home. And for me, one of the experiences I had as a senior was kind of finding opportunities that kind of fell outside of traditional recruiting, especially within that intersection of healthcare and business. So I want to always advise and guide current students who are interested in doing kind of what I did as best as I can, and to kind of shine a little bit of light in an area that doesn't get a lot of coverage. So during my time at Georgetown, I was part of a pre-orientation program that kind of ended up taking up most of my years called Leadership and Beyond. I also was part of Georgetown Radio, played intramural basketball, and was an intern at Georgetown Hospital. I'm just providing that to show that I am as much of a former student as you may not think that I am, but I am, even though it was only 4 years ago. So I don't know if this is blocking, maybe it is. So to provide some context, when I was a senior, I always felt that I came into Georgetown for a purpose. And I'm not talking about one of those sort of idealistic, unrealistic purpose. I just mean, I want to learn about healthcare, and for that reason, I want to be a healthcare management major. So when I was looking to kind of transition out of Georgetown, I kept asking myself, as the visual shows, I study healthcare for a reason, right? And the opportunities I was considering, which ultimately is my crossroads, was a career in consulting, investment banking, hospital administration, or the unknown. So for me, what I ultimately ended up deciding was, how about I just kind of use the industry knowledge that I have, that I learned, and kind of go towards the hospital administration and the unknown route. So that ultimately brought me to Mount Sinai. So I graduated from Georgetown, as I said, 16, and my first job was at Mount Sinai, where I was basically took on an analyst level role, which gave me a rotational capacity where I can kind of juggle projects from both a financial standpoint, a transformational standpoint, and even a venture capital standpoint. So I'll get into all of that in a little bit more detail in the later slides. But after Mount Sinai, I transitioned into a company called CareCentrix. So CareCentrix is a company that works with health plans and helps them manage their costs. And the role I took there was a growth strategy role. So a lot of the work that I did was focused on structuring strategic partnerships with either health plans, employers, or health systems, and looking for different ways to grow revenue and for the company to grow either inorganically through acquisitions or even a merger. After Horizon, I after CareCentrix, I shifted to Horizon, where I was kind of offered a promotional opportunity to join the corporate strategy and development team, as Horizon was and is one of CareCentrix's clients. So I'm still at Horizon. As for my future outlook, not sure. Business school is something that I am currently contemplating. But we actually had on my team at Horizon, one of the analysts leave to take a director level position at Teladoc, which is a up and coming telemedicine company. So one of the things that I kind of really took note of when I was doing my networking as a senior, and even kind of my few years out of school, is there isn't a lot of clarity and a lot of, I want to say, transparency in terms of why people leave. Now, one of the goals that I had today was to kind of bring that to light a little bit, to kind of show how I made the career decisions that I did, and kind of what I learned from each role, and kind of the both professional and I guess maybe personal reasons to why I left. So my role at Mount Sinai, I was an analyst and I was supporting the Primary Care Institute, who had an initiative to move from fee for service to value based care. I know a little healthcare nuance there, but basically it means that they're looking to move a specific payment model where physicians were getting paid for every service to a model that was a little bit more for pay for performance. So I juggle projects like that. I help the VC, which is the venture capital arm, invest in cool startup companies. And I even work with the Department of Medicine to help with any sort of FP&A assistance that they needed. So at a high level, the day-to-day, I kind of provided that for you guys because I know people, when I speak with a lot of you guys, there's always a question is, what does that day-to-day look like? I kind of left that for you guys to read. I'm happy to go into it in a little bit more detail during the Q&A. But at a very high level, mornings kind of start with a lot of meetings and kind of reading the news. Afternoon is more to allocate work and any sort of additional projects that I'm juggling. And in terms of valuable skills, those have been pretty much the same throughout most of my career, which is kind of being able to be independent, Excel skills, both analytical and quantitative skills, PowerPoint skills, and really kind of having that healthcare industry knowledge and a sense of problem solving. So why I left Mount Sinai for CareCentrix, and maybe I didn't do a great job of even explaining what CareCentrix is. So CareCentrix is a company that, as I said, partners with health plans, and their goal is to make sure that the patient that is at the hospital can receive the best quality care at home if possible. Because there's a consistent push to move people to the home as a lot of these nursing facilities and even hospitals become extremely costly. And frankly, most of the times, the reasons why they are is less because you actually need to be there, but more for logistical purposes that don't benefit you in any way besides more dollars out of your pocket. So why I left is during my time at Mount Sinai, when you look at the entire healthcare value chain, you notice that there's these healthcare delivery entities, which are hospitals or even doctors' offices. And then you have this overarching managed care industry, which is kind of health insurance plans and even companies like CareCentrix, which manage both hospitals and health insurance plans. So kind of realizing that and recognizing how big the landscape was, I gained an interest in learning a little bit more about the managed care industry and try to do as much as I could at Sinai, but felt that transitioning to a role at CareCentrix would give me a wider scope and an ability to really tap in and be a part of the managed care industry. And it also, from a personal standpoint, gave me the opportunity to work in a lean team, meaning more responsibilities with ex-consultants and industry leaders, and kind of gain more of a strategic skill set than I would have had during my time at Mount Sinai, which is a little bit more of a rotational and kind of project management kind of based role. So during my time at CareCentrix, I was, as I said, was a growth strategy analyst and focused on structuring a lot of partnerships. The day-to-day was not very different from kind of the day-to-day that I had at Mount Sinai. But at a high level, I would say the difference is the exposure. So as you can see kind of under the afternoons, there's a lot of kind of talks and kind of discussions with business development VPs in terms of some of the health plans or even health systems that they are interested in partnering up with, and kind of picking my brain in terms of what is within that market that we can kind of tap into, and what are the opportunities that we can gain and they can gain from a partnership from them working with us, and how can we ultimately deliver them value, which is ultimately a cost-cutting shared savings kind of mechanism. So my tenure at CareCentrix was a lot shorter than I had anticipated. I actually wanted to stay there as long as I could, but I was given a promotional opportunity at Horizon, which was one of our clients. And the promotional opportunity allowed me to work directly with C-suite. And that was something that I never really got to do at either CareCentrix or Mount Sinai to the degree that I would have at Horizon. And I ultimately decided to, kind of take that leap and join a team. It gave me an opportunity to be a senior analyst, do corporate strategy and corporate development, and regularly present to the chief strategy officer, chief operating officer, and even be a part of a bigger team that had a little bit more of a robust analyst program, which to me, I felt like I never really had an opportunity to kind of get in my other jobs. And at the end of it, I think the biggest thing was I had an opportunity to do really impactful work that impacted a lot of people, specifically those that have Horizon Insurance in New Jersey. So hopefully that was helpful for you guys to kind of hear kind of my career trajectory. But obviously, that's just a narrative that I can share, and there's nothing really tactical that you guys can gain from that. So one of the things that I wanted to do was to kind of give you a little bit of an idea of what kind of jobs are out there in the market, especially those that kind of fall outside of those more traditional recruiting pipelines, and those that fall within that intersection of healthcare and business. Jody had actually shared with me a list of the people who plan to attend this session today, and I saw there was quite a few biology majors. So that was actually something I also wanted to address here. So I didn't want to get too deep into each of the companies, but at a high level, there's a lot of companies, and this is not exhaustive by any means. And some of these may be more focused kind of in the DC or Northeast area, and there may be way more outside, kind of in the San Francisco Bay Area that I'm not aware of, or even cities like Denver or like Austin. But during my time kind of looking for opportunities, these are kind of the companies that came up. Crossix is one. They actively recruit at Georgetown, and it was actually founded by a Georgetown alum. Roivant is another one. So that's a biopharma company. They have an analyst program. I don't know if they actively recruit at Georgetown, but I do know that the analyst program is relatively new. Capsule is another one. Oscar Health, a startup health insurance company. CareFirst, and the Denham Group. So the Denham Group, actually, I've seen a lot of Georgetown students go into post-grad. And this was a specific call out I wanted to make for people who are really interested in kind of the intersection of biology and business. Kind of that biopharma space is really perfect for that. Now, I think it's ultimately kind of up to your interest, but that definitely exists. It doesn't just have to be healthcare delivery and healthcare services. It can be a lot more specific to kind of even the molecular level. But yeah, these were the opportunities that were out there. Happy to talk more about it. And there's definitely more. But I've seen a lot of people within Georgetown kind of go into these companies. And for me, one of the ways that I was able to actually talk to most of these companies actually was through networking. I reached out to a lot of Georgetown alums, and they're really helpful, kind of guiding me through what the interview process looks like and things I should look out for, and even learning more about the role in the company in itself. So I know I kind of sped past that, but again, I wanted to make this session for you guys, answer any questions and be as helpful as I can, and give you back time if you have to study for midterms. But I, again, wanted to thank Jody for putting this event together. And I highly encourage all of you guys to reach out to her if you have any questions. She's a really great resource, and she's really good at kind of keeping alumni connected.